So where in clinical history would we ask for investigations? So for example, we know clinically probably it looks like a 3 months chronic backache. And so where we because X-ray and the other findings, I mean X-ray usually would show us much later in the
Correct.
spectrum. So when do we ask for investigations, at what span,
So
like
I
within six
ask for
months?
investigation the first day they come, because I need to have some documentation also in today's day and time, and we are in the city of Mumbai. So I will ask for investigation day one itself.
So
When I
preliminary
am
would,
thinking of an organic lesion, I mean, if I have a backache where I'm very sure that this is just postural or this is a psychological pain, when I know that I'm not going to find anything in the investigation, I'll not. But I'm talking relevant to this topic, that you are suspecting an inflammatory backache and your clinical suspicion has to be documented, be it in negative or positive. I will ask for basic investigations,
that's the X-rays,
X-ray, blood, and
serological.
even MRI. So depending on the patient's capacity or the patient's personality.
So it wouldn't be like, okay, you have for around 3 months, we'll wait, how does it go, and then we'll do an X-ray because,
So that will again depend on your rapport with the patient. Look, I have patients who have been my family patients for 25, 30 years. They believe me fully. So they say that I don't mind if you don't do a single test. If you're saying this is this, I'm going with it, I'm okay with it. Then because of that rapport, I may not ask, because I'm very sure clinically. But if it's a new patient, or I know that patient for long, but I know that this patient is someone who is going to Google, this patient is someone who will want to do find out more, then I will document that by doing the relevant investigation. I mean, I may go even and do an MRI to find out if there's a sacroiliitis seen.
yeah.
Plain X-ray did not show sacroiliitis, but the MRI showed a sacroiliitis. Then I have a documentation of that fact. Yes, today's day and time, yes. Maybe 20 years before, I may not have done all this.
So would that matter? I mean, I'm talking also about the serological investigations in your follow-up criteria, like the inflammatory
So
markers.
inflammatory arthropathy, as a RA and all, inflammatory markers will be of relevance. In seronegative arthropathies like this, there are hardly any markers which will be of much relevance unless you have a very major inflammatory flare-up where you will find the ESR and CRP also very high, and then subsequently when they are clinically better, you will find that the ESR and CRP are going down. But otherwise, the inflammatory markers as a blood phenomenon, I don't see much
So we have to only rely for the follow-up criteria on only the clinical
clinical.
history and examination
Correct.
findings.
Absolutely. X-ray findings, the facet joints here fuse from here to here. So that's C2, C3, C4, C5. This is like a block. The mobility is taking place here. Sacroiliitis, marginal erosion, syndesmophyte. Now, asymmetric syndesmophyte is classic of writers.
When I order an MRI, do I have to write whether I want a T2 weighted or a T1 weighted, and
No.
when should I ask
No.
for it?
So T1 weighted, T2 weighted are standard sequences. You will get, if you ask for a MRI from a standard place, they will give you a T1 weighted and a T2 weighted axial and sagittal imaging. Some
Okay.
of them will also give you a coronal fat sat image.
Okay.
So these are standard imaging things for from standard MRI machines. These days what is happening is, because people want it at a cheaper rate, lot of centers which are not the standard centers, but they give you all these small they will give you only maybe a sagittal screening, or they'll just give you a T1 weighted axial cut. So then you are neither here nor there.
So when I'm ordering an MRI, I'll just write the location which I want to visualize.
Correct.
That is all.
Correct.
The rest
You
has to.
may actually, even if you feel that you want a relevant finding, you can write in the bracket that I am looking for sacroiliitis, or I am
Okay.
looking to rule out dish, or I am trying to rule out a disc prolapse at L4-5 level,
Correct.
and tell the patient that when you go to the MRI person, don't show this to the receptionist, tell them, let the doctor read this. So
Okay.
then when the doctor is knowing the clinical relevance, they will try to see the image from that perspective. Because what happens most of the times in MRI places is that you've written a requisition, It is seen by the receptionist. Receptionist does not know what it means. The person who is the doctor is just knowing that this is the study. He or she may not have taken the history. So then the relevance is lost and a small finding which is of relevance is missed.